Intercostobrachial nerve is a branch of second intercostal nerve. In deltoid paralysis, which nerve is involved? Axillary nerve. Ulnar nerve injury at wrist spares which muscle? Opponens pollicis. Muscles attached to hook of Hammett is flexor retinaculum. Finger by which all the muscles in the hand can be tested is thumb. Arterial supply of latissimus dorsi is subscapular artery. Nerve damage due to lunate dislocation is median nerve. Adduction of hand at wrist is done by extensor carpi ulnaris. Muscles supplied by median nerve are abductor pollicis brevis, opponens pollicis, first lumbrical, and flexor pollicis brevis. Lateral border of cubital fossa is formed by brachioradialis. Small muscle of hand are supplied by C8T1. Median nerve injury at elbow affects adduction of thumb, flexion at distal interphalangeal joints of second finger, flexion of proximal interphalangeal of third finger, flexion at first and second distal phalanges fingers. Low ulnar nerve palsy is characterized by claw hand and weakness of grip. Thenar eminence is supplied by median nerve and ulnar nerve. Injury to radial nerve in lower part of spiral groove results in paralysis of anconeus muscle. Head of coracobrachialis is known as Struther's ligament. Which of the following is not attached to pisiform bone? Flexor digitorum superficialis. The pronator quadratus has the same intervention as the following innervation as the following muscle. Flexor pollicis longus. Tubercles of Montgomery is seen in breast. In a vehicular accident, the musculocutaneous nerve was completely severed, but still the person was able to weakly flex the elbow joint. All of the following muscles are responsible for this flexion. Ulnar head of pronator teres. Nerve passing through the spiral groove of the humerus is radial nerve. Muscles attached to the greater tubercle of humerus, supraspinatus, teres minor, and infraspinatus. Muscles attached to the coracoid process, coracobrachialis, short head of bicep, and pectoralis minor. Which of the following does not supply the breast with blood? Costoclavicular artery. So which are the suppliers of breast with blood? Lateral thoracic artery, thoracoacromial artery, and posterior intercostal arteries. Which of the following among axillary lymph nodes is a terminal group? Apical. The carpal tunnel contains all of the following important structures except flexor carpi radialis. It includes median nerve, flexor pollicis longus, and flexor digitorum superficialis. Compression of a nerve within the carpal tunnel products inability to abduct the thumb. A 43-year-old woman came with a large abscess in the middle of the right posterior triangle of the neck. The physician incised and drained the abscess. 5 days later, the patient noticed that she could not extend her right hand above her head to brush her hair. Which of the following are the signs and symptoms of additional harm? Cut to spinal part of accessory nerve. Axillary nerve supplies deltoid and teres minor. Ligament of shoulder joint are all except coracoclavicular. So glenohumeral, coracohumeral, and transverse humeral are ligament to shoulder joint. All of the following drain into azygous vein except left superior intercostal. So which veins drain into azygous vein? Accessory homozygous, 4 to 11 posterior intercostal on right side, and esophageal veins. In clump paralysis, all are involved except C6. So what is involved? C7, 8, and T1. Winging of scapula is due to injury to long thoracic nerve. Axillary sheath is derived from prevertebral fascia. Power grip of hand depends upon long flexors of the fingers. Which of the following nerves accompanies the profunda brachii artery radial? Erb's point is formed by C5 and C6. In Erb-Duchenne paralysis, the injury is limited to the 5th and 6th cervical nerves. All are functions of latissimus dorsi except external rotation of shoulder. So what are the function of latissimus dorsi? Extension, adduction, and medial rotation. Nerve supply of trapezius is accessory nerve. The rotator cuff muscle include all except teres major. So what are the muscles included in the rotator cuff? Supraspinatus, infraspinatus and subscapularis. In ulnar nerve injury in arm, all of the following are seen except adduction of thumb. So what is seen? Hypothenar atrophy, loss of sensation of medial one third of hand and claw hand. In obstruction of second part of axillary artery, the anastomosis between the following artery will maintain the blood supply of upper limb. Deep branch of transverse cervical artery and subscapular artery. If median nerve is injured at the wrist, then loss of function of all the following will take place except adductor pollicis. So, which loss of function will take place in lumbrical muscles to the index finger, lumbrical muscle to the middle finger, and muscles of the thenar eminence. Movements taking place during abduction of shoulder joint are all except medial rotation of scapula. So which are the movement taking place during abduction of shoulder joint? Axial rotation of humerus at acromioclavicular joint, elevation of humerus, and movement at clavicular end of sternoclavicular joint. All are functions of latissimus dorsi except external rotation of shoulder. So extension, adduction and medial rotation are the functions of latissimus dorsi. Nerve supply of trapezius is spinal accessory nerve. Which of the following muscle is supplied by deep branch of the ulnar nerve? Adductor pollicis. The following structures pass through the carpal tunnel except ulnar artery. So median nerve, flexor carpi radialis tendon and flexor pollicis longus tendon passes through the carpal tunnel. Not seen in distal radial nerve injury is inability to extend finger. So which are the what is seen in distal radial nerve injury? Weakness of extensor carpi radialis brevis and loss of sensation over dorsum of hand and paralysis of brachioradialis. What is the action of anterior fiber of deltoid? Flexion and medial rotation. Fascia around nerve bundle of brachial plexus is derived from prevertebral fascia. Content of anatomical snuff box are radial artery, tendon of abductor pollicis longus, tendon of extensor pollicis brevis, scaphoid bone, and superficial cutaneous branch of radial nerve. True about pectoralis major muscle. Blood supply by perforating branch of internal thoracic artery, blood supply by intercostal artery, and nerve supply by intercostal nerve. Concerning brachial plexus, which of the following facts are true? Formed by spinal nerve C4 to C7, most common site of injury is upper trunk. Injury may occur during breech delivery. Lower trunk injury results in hand deformity. First, extensor compartment of wrist have which of the following structures? Extensor pollicis brevis and extensor carpi radialis longus. Muscle supplied by median nerve, opponens pollicis, abductor pollicis brevis and flexor pollicis brevis and first lumbrical. Artery in anatomical snuff box is radial. Deltoid ligament is attached to all except medial cuneiform. Deltoid ligament is attached to medial malleolus, spring ligament and sustentaculum tali. Which of the following movements of thumb are not affected in radial nerve injury? Opposition, abduction and adduction are not affected in radial nerve injury. Which of the following muscles is enclosed within the clavipectoral fascia? Subclavius. The ossification center of pisiform bone appears at the age of 12 to 13 years. Intrinsic muscles of hand are innervated by ulnar nerve and median nerve. Fall on outstretched hand leads to fracture of the following bones: scaphoid bone, capitate and clavicle. First, dorsal interosseous muscle of hand is supplied by deep branch of ulnar nerve. Which of the following arteries supply pectoralis major muscle? Pectoral branches of thoracoacromial artery and intercostal arteries. Deep branch of ulnar nerve supplies adductor pollicis and third 3 lumbrical. True about peripheral nerve injury in upper limb. Radial nerve injury causes anesthesia over anatomical snuff box. Ulnar nerve injury causes claw hand. Index finger anesthesia is caused by median nerve injury. Content of bicipital groove are ascending branch of anterior circumflex artery. The following structure does not pass through flexor retinaculum. Ulnar nerve does not pass through flexor retinaculum. Median nerve, flexor digitorum profundus and flexor digitorum superficialis passes through the flexor retinaculum. All of the following muscles retract the scapula except levator scapulae. So which muscles retract the scapula? Trapezius, rhomboid major and rhomboid minor. All of the following movements occur during abduction of shoulder except medial rotation of scapula. So which movement occur during abduction of shoulder? Elevation of humerus, axial rotation of clavicle and acromioclavicular joint movement. The following structures are attached to the greater tuberosity of the humerus except subscapularis muscle. So supraspinatus muscle, the coracohumeral ligament and the teres minor muscle is attached to the greater tuberosity of the humerus. Muscle that can extend the middle distal phalanx of the index finger include all except extensor carpi radialis longus. So which muscle that can extend the middle distal phalanx of the index finger? The first dorsal interossei, the first lumbrical and the second palmar interosseous. Ulnar nerve injury at wrist spares which muscle? Opponens pollicis. Erb's palsy occur due to involvement of upper trunk of brachial plexus, which are not the flexors of forearm. Anconius and flexor pollicis longus are not the flexors of forearm. Pronator teres, brachialis and brachioradialis are the flexors of forearm. True about radial nerve. Branch of posterior cord, nerve of extensor compartment of forearm, arise from C5 to T1 and supply skin of extensor compartment. Rotator cuff is all formed by all except teres major. So rotator cuff is formed by supraspinatus, infraspinatus, teres minor and subscapularis. Carpal tunnel syndrome is caused by all except amyloidosis. Carpal tunnel syndrome is caused by hypothyroidism, Addison disease and diabetes mellitus. Neurovascular bundle in axilla is surrounded by sheath derived from prevertebral fascia. All of the following muscles retract the scapula except levator scapulae. So trapezius, rhomboid major and rhomboid minor retract the scapula. Boundary of triangle of auscultation is not formed by serratus anterior, it is formed by scapula, trapezius and latissimus dorsi. Axillary abscess is safely drained by which approach? Floor. Which amongst the following is a branch from the trunk of brachial plexus? So suprascapular nerve is more appropriate answer than nerve to subclavius. Main muscle of opposition is opponens pollicis. Which tendon is frequently absent in upper limb? Palmaris longus. Carpal tunnel syndrome involves median nerve. Which of the following is a modification of deep fascia? Extensor retinaculum. Rider's bone are ossification of adductor longus. Anatomical snuff box is formed by all except extensor carpi radialis. So anatomical snuff box is formed by abductor pollicis longus, extensor pollicis longus and extensor pollicis brevis. All the following structures are attached to the coracoid process except long head of bicep. So which are the structures attached to coracoid process? Brachialis, coracobrachialis and short head of bicep. Short head of bicep is attached to coracoid process. All are branches of posterior cord of brachial plexus except long thoracic nerve. So which are the branches of posterior cord of brachial plexus? Axillary nerve, thoracodorsal nerve and radial nerve. Superficial branch of ulnar nerve supplies palmaris brevis. Short head of bicep is attached to coracoid process. Carpal tunnel syndrome is due to compression of median nerve. Which of the following is known as the laborer nerve? Median nerve. All of the following are composite muscle except flexor digitorum superficialis. So which muscles are composite muscle? Adductor magnus, pectineus and flexor digitorum profundus. How to test for the long thoracic nerve? Raise the arm above the head.